One of the keys to reopening the country is knowing that a second outbreak can be prevented. And the answer may lie with disease detectives called contact tracers. Sam Brock reports.
In cities desperately fighting to corral the coronavirus.
Trace every person who comes up positive. Trace means investigate.
Like New York, Houston, and Los Angeles.
We need to know if you're positive so we can contact people you've come into contact with.
A secret weapon's emerging, critical to combating second and third waves of outbreaks. It's not an app, but a long-standing workforce redeployed.
This is exactly what we've been doing, but with sexually transmitted infections and HIV.
Tech titans like Google and Apple may be working on a digital solution, but people like Guadalupe Valdivinos and 1,600 other disease detectives have been tracking infections for years. Normally, they'd be knocking on doors. Now, with social distancing guidelines, they're reaching out by phone. Their work often taking them to low-income and minority communities, disproportionately impacted by the disease.
Symptoms are very important. The onset of symptoms, the duration of symptoms. Who have they had contact with? Who do they live with?
Without intervention, a person infected with COVID-19 can come into contact with others they know, potentially exposing them. Those individuals can then interact with even more people, perpetuating a vicious cycle. The idea is to break that chain of transmission by isolating the source as quickly as possible.
We need tried and true experts on the ground who know how to do this work.
David Harvey leads the National Coalition of STD Directors and points out a gaping hole in need. A new report from Johns Hopkins advocates adding an extra 100,000 contact tracers, a role Harvey says takes a year to properly train.
If we can bail out the American airline industry with $250 billion, we can sure as heck allocate $250 billion to the public health system.
States like Massachusetts, Minnesota, and Illinois have begun boosting their contact tracer ranks in an effort to meet a surging national need.
And contact tracing is most effective, not with people you might pass on a stroll outside, but when you're in close contact, let's say 6 feet or less, for a sustained period of time. Jose?